So people, only access was the postcard, inner or postal covers. So they used to write to me, and then I used to counsel them through letters, handwritten letters, 40,000 letters. I think is one of the record break. A doctor communicating with his patients through postcards, inland letters, and covers.
That's amazing.
Yes.
Welcome to the Trouvaille Spark, stories that light you up. Today we have a very special guest, Padma Shri Dr. C.R. Chandrashekar, fondly known as the People's Psychiatrist. A doctor, an author, and a change maker, Dr. Chandrashekar has devoted his life to making mental health care accessible to everyone. Watch how he makes a difference. Dr. Chandrashekar, it's such an honor to be talking to you today. Let's start from the beginning. What inspired you to take medicine, and why did you choose psychiatry, especially at a time when people rarely talked openly about their mental health?
See, I completed my MBBS way back in 1973, 52 years ago, from Bangalore Medical College. Then before that, two people inspired me to take up psychiatry.
Oh, okay.
One is Srimati Trouvaille. Even today, she is a very popular name in the field of literature in Kannada.
Oh.
She was a BA graduate. She used to come to mental hospital and get to know about the cases. Went back and wrote more than 10 novels based on psychiatric subjects.
Wow.
Some novels have become movies, especially Sharapanjara. Sharapanjara is a very, very beautiful movie made on the plight of mentally ill. How people look at a mentally ill person. The heroine becomes mentally ill because of past bad experience. Then husband rejects her. Then family members reject her. She was taken to hospital. She becomes all right, but society never accepts her as a normal person. So it's a tragic story, beautifully displayed both in the novel as well as in the film. And another book, Muchida Bagilu, Closed Door. So she talked about the various seriously mentally ill people locked up in mental hospitals. So she inspired me, and when I was in high school, I had read all the novels. Then second person is Dr. M. Shivaram. He is the founder of Bangalore Medical College. He was a BA psychology, then did MBBS. He was a practitioner next to Majestic Talkies, and he wrote two books. One book on psychosomatic diseases, Manonandana, way back in 1965. I read around 1970. Then Manamantana, the only book on science, got Sahitya Academy Award. It's a classical book, Manamantana. It's a classical book, even copies are available. In that he explains all mental disorders in modern language, modern scientific language. So these two inspired me to develop interest in psychiatry. And Dr. H.S. Narayan was an assistant surgeon working in mental hospital. He used to come to Bangalore Medical College once a week on his own, run a free clinic. Because in all the 4 government medical colleges in 70s, all 4 private medical colleges, nobody had heard of psychiatrist or psychiatric disorders. So we used to come to Victoria, and then myself and my senior, Dr. Mohan Isaac, we used to join that clinic.
Okay.
And then H.S. Narayan is a great person and great psychiatrist. The way he used to interview people and every case, he used to explain in such a way that how mind works, because mind cannot be seen. You can see the body, but mind cannot be seen. So many people used to come with somatic symptoms. I have a headache, my girl, daughter faints, and the doctor says it's not fits. They referred her to you. And schizophrenic patients, bipolar patients, depression patients, hysterical convulsion reaction patients used to come, and then we were assisting Dr. Narayan, and both Dr. Mohan Isaac and myself joined for DPM course because of his pressure as well as with affection, he invited us. Please come and do psychiatry. We don't have psychiatrists outside two mental hospitals of the state. One is Dharwad, one is Bangalore. And people call it Huchaspatre, Pichaspatre, Pagalkana. That was the name given by, even today, sometimes NIMHANS is referred as Old Mental Hospital, Huchaspatre. And people were scared to go there.
So, do you remember your very first experience treating a patient as a psychiatrist?
No, in Victoria Hospital, one girl was brought with fainting attacks. She was a faint, and then 10 minutes later she would get up and say, what happened to me?
Okay.
And the physicians has examined her, and they ruled out possibility of fits or any organic condition.
Okay.
Then during the interview, in the second interview, we came to know that she was studying in 10th standard, and parents were already ready to arrange a marriage. Stop your studies, we got a goodbye for you, and we'll arrange a marriage. She didn't like it.
Okay.
Then she pleaded, no, I want to continue my studies, and they said, no, girl should not study more, otherwise it will be very difficult to find a suitable boy for you. We have found a very good boy, very good family. They pressurized. And even Nishitartha was, engagement ceremony was conducted. Then she started getting these fainting attacks. Then parents got scared, and even the boy and in-laws got scared. Oh, this girl is not well, so engagement was cancelled. That was the source of stress, and indirectly it's a hysterical conversion reaction. She was presenting herself, say, I don't want this marriage, and she used to faint, get a lot of sympathy from others, and because of that, marriage was cancelled.
Okay.
So this one case, even now I have written this in my first book.
Okay. And were you nervous, or what did you feel when you were treating the case?
No, because Dr. H.S. Narayan used to teach us in such a way that like a detective story.
Okay. Your work has gone beyond the hospital, and you have a free mental health clinic, and you've written books, and you do a couple of workshops. What inspired you to start Samadhana as a free mental health clinic?
No, because way back in 1980, one NGO approached us, sir, we have volunteers. So NGO, volunteers were chosen, youngsters were chosen, agreement was made, they will work for 3 years in the field of education and rural development and health. They said, can you train them in mental health?
Okay.
We took the challenge and trained, and we ran Prasanna Counsel Center 1980, even today it's running.
Okay.
And found out that these trained people with short training, they can do counseling.
Okay.
And when my parents died, so we thought we'll start a NGO, a family trust, and started this way back in 2007. Now it is 18 years old, and more than 36,000 people have come and taken treatment.
Oh, wonderful.
36,000 people, totally free of cost. And volunteers, we train them, and they come for some time, they work and go, then new will come and work.
Correct. And were you working in NIMHANS when you started this?
Yeah.
And how did you manage your time then?
At that time it was the evening only.
Okay.
Now both evening and morning 3 hours, evening 3 hours. Because NIMHANS permitted me, because it was a free center.
Okay.
Because NIMHANS, nobody is allowed to do practice.
Okay.
So when I said it's a charitable trust and we are doing free service, director of NIMHANS, Dr. Nagaraj, he came and inaugurated. You can see the photos if you want to take the old photos. And so now, from day one, it is running and becoming more and more popular. We bought this house for this purpose only.
Oh, okay. And do people need to fix appointment, or they can walk in?
No, here, no appointment, walk-in. It's a walk-in, later, subsequently appointment.
Okay, okay. And they can find Samadhana Center on the internet and just come approach you. So you have a questionnaire or something, like how do you train the...
Both, there's a questionnaire, I will show you, 20 questions. Are you sleeping well? How is your appetite? Are you able to think well? Are you able to do your routine work. So there are 20 questionnaires or interview. Because we trained how to interview a person the shortest time possible, and depending upon the source of stress, explore. Counseling is a skill as well as a science and art. So in Samadhana we have trained more than 3,000 people, now 54th batch is running. We conduct 12 sessions, Sunday sessions, 10 o'clock to 1 o'clock.
Okay.
And 10 lectures, 12 lectures are given by a group of resource people. I take 2-3 classes. And there are other people who are trained, who are senior counselors, or Shobha, she is the director of collegiate education. Then Mr. Gundurao is a humorist. So we invited different people from different background, and they conduct classes. So the last 52 years we have developed programs so that even common man is involved both in identifying a case. Many patients here, how you came to know? No, my neighbor came here and he referred me.
Okay.
Or I talked to my aunt who is in Chennai. She said, go to Chandrashekar, the Samadhana Center, it will be helped. So by word of mouth, and also articles and books. So one book they buy and some 10 people read.
Correct.
And they get educated and they know psychiatric disorders are treatable. And no stigma, like body becomes ill, mind also becomes ill.
Confidentiality is such an important part of mental health. So how do you and your team make the patient feel like, safe and maintain anonymity?
One is respect every person who comes to us. This is the basic thing we tell counselors. Don't think that, they are poor, they are ill. Show sympathy, but respect.
Okay.
One is respect. Second thing is, you should not do a police inquiry. Asking questions should not be, hey, tell why you did that, what happened to you, why you took alcohol. So it should not be a police inquiry, it should be very polite, asking questions, so that the trust is built up between the counselor and the client.
Okay.
And tell the person that, do you want your father to stay here? No, sir. Then we request the father, please stay outside. Your son wants to talk to us. Or if your wife says, I want to talk, husband is sitting there. If she doesn't want husband to listen, so we give privacy. Or if you say, okay, he knows my problem, let him be there, then we. So with the permission of the client only, we allow other people to stay. Or we don't want to share anything which is sold by client to others.
Okay.
We tell them, you talk freely, everything is kept confidential. We don't enter certain items, some extra marital, we don't enter the case file.
Okay.
Because somebody may take it and read it.
Okay.
Isn't it?
Correct.
So, or he has done a crime, but anyway, he's not arrested. So if he talks about, yes, I did a crime, I hit a person and I broke his leg, but it became a police case, I'm guilty about it. So such confidential issues are not even entered in the case file.
Okay.
And then we tell them that without your permission, we will not reveal to anybody else. Even if my husband comes, did my wife come last week? What she said, sorry, it's confidential.
So when people have these concerns
Yeah.
that they are going to become dependent or it's going to cause them drowsy, they feel drowsy. So how do you reassure them?
Fortunately, we have medicines, very, very milder side effects. No side effect. We tell them, take the medicine, 3 days later, contact us. They're quite safe. If you develop any side effect, it's only temporary, it's mild, it doesn't kill you. Doesn't cause any damage to the liver, damage to the kidney. So reassurance, education, and I give, they pick up one book and I tell them read.
Okay.
So every day about 10 to 20 books are sold here. We have got printed at a very cheap. This we give for only 50 rupees.
Oh, wonderful. Okay. Where else are these books available other than?
Now, two major publishing institutions. One is Karnataka Publications, Karnataka. They are top one. Swapna Publication, again top one or top two. They have published majority of my books.
Oh,
About at any given point in time, you get 150 books available You can go and approach their branches or get the book through courier or postal or Amazon and any other. Don't do anything. So.
And how do you decide, these books, I have read 1 or 2 books and it's very simple and easy to implement and any age, they can read. So how do you decide what?
This way say popular science writing. You must have heard of Narlekar. Narlekar, he brought the concept of popular science literature.
Okay.
So very difficult technical science. He made it very, very simple so that a person with 7th standard education or 10th standard education will be able to follow. So same thing we are following, popular medical literature. And Karnataka is leading. More than 150 doctors have written medical literature in Karnataka.
Okay.
And in next is Kerala is good. Whereas other states, none of the doctor writes. You don't find literature if you want in Hindi. You don't find literature in Telugu or Tamil. Only a few people write and they're not popular. As you said, the way they write is not very interesting.
Right.
So the technique I follow, Dr. Shivaram,
Okay.
is through a case story. Start a case story. Start your experience. Like Shivaram Karan says, if you write with experience, that becomes popular. If you write only with knowledge, it won't become popular.
True, because people cannot relate to it.
So, my experience of dealing with people, or is like, tell me an interesting case. Now, you will not forget a girl who gets fainting attacks because she wants to avoid getting married. So, suddenly, people say, yes, illness can come like this, and there is a stress factor. And people say, what's the ratio between she fainting and not willing to get married to a particular boy? So we have to explain how mind works. So in that way, simple language, then small books, don't write big books.
Correct. Otherwise people lose interest.
As soon as they read that book, big book, oh, it's big books, you don't have time to read. Now people want to 3 lines, 4 lines, message or Instagram, a picture, a diagram.
Correct.
So we use all these techniques to put lot of pictures and case stories.
And you write both in Kannada and
English, and some of my books are translated to Gujarati.
Oh, wonderful.
And Telugu and Urdu and Hindi.
Oh, nice. And workshops, you've conducted a lot of workshops.
Yeah.
So what are the places and whom is it catered
now,
for?
throughout Karnataka, throughout India, we have conducted workshop. Even now, my juniors are, because National Mentor Program, my 2 colleagues, Dr. Suresh and Dr. Naveen Kumar, every week they'll be going to one state to conduct training programs or to monitor the program. And NIMHANS is a Telemanas. Telemanas 14466.
Okay.
Is a early level toll-free phone call point. And in 20 languages you can ask questions.
And is it for medical professionals or even for the common public?
No, medical, non-medical and lay people.
Oh, okay. You've treated lakhs of patients till now. So what is one moment or experience that moves you even today?
No, so many initial cases. Like one person, Rajappa in one of the village in Surod, he was bedridden for 6 years. Bedridden. Okay. Always lying down on the bed in the hall, and he would stare at the roof, and wife used to feed him. Just like a puppet, swallow the food, and just to give him a bath there only. That person, he was a schizophrenic. Then they thought they tried all traditional methods, didn't improve. They said, this is our fate. I should tag the wife because she didn't go for divorce. Then when we gave the first injection, and 1 month later we went, so people gathered, sir, you have done miracle. When Rajappa has come out to see, he is working in the field. Just one injection, he was in a, what we call, schizophrenic stupor for 5 to 6 years. With one injection, within 10-12 days, he came out of his condition. And so everyone recognized when he came because now clean shaven and neatly dressed. They have a big beard and big mustache, nails half an inch growth.
That's so amazing.
Amazing. Another lady used to go from Lakshmipura up to Asur just by walk. She would go 2-3 months walk, beg and leave and come back. And say, ಹುಚ್ಚಿ ಅವಳು ಹೋಗ್ತಾಳೆ ಬರ್ತಾಳೆ ಸರ್ 3 ತಿಂಗಳ ಬರ್ತಾಳೆ. She will come back after 3 months.
Oh, okay.
Husband never bothered, raised bothered. She will come back and then that lady within 3 months she stopped going away. She stayed and she used to come to Saklavara and take medicine and say, sir, you saved me because such a torture of walking up to Osur. I used to develop lumps on the feet. Some people would give food, some people will not give any food. They will stop for 24 hours, 48 hours. No, all that pain has gone.
You were awarded the Padma Shri in 2024. So how did it feel and has your life changed after that?
No, nothing. Only more recognition.
Okay.
More recognition. No, more and more people. Sir, it's the first time a Padma Shri holder is Padma Shri award coming to a function.
Oh,
When yesterday,
okay.
all India radio people, they invited me. So why you invited? No, sir, you're Padma Shri holder and you know Akashvani for last 55 years. So 80 awards are there, but I never applied for asked for any award.
Super.
Karnataka government has given 6 awards: Rajyasabha Award, Mahatma Gandhi Seva Award, then Dr. Napama Niranjan Award for Medical Literature. 6 awards from Karnataka state government, and Government of India 3. Way back in 2002, Science Communication by Science and Technology. So on India level, only 8 people from Karnataka got this award. The award for Science Communication.
Wonderful.
Science and Society Bridging the Gap.
Okay.
Then UGC gave the National Award, and Padma Shri is the 3rd National Award.
Wonderful.
So 25th, now people were, sir, you should get Padma Shri Award. I said, if they want to give, let them give, otherwise I am not bothered. So 25th, 12:30, a call comes from Delhi. We are from Home Ministry. Are you Dr. Chandrashekar? Yes. You are shortlisted for Padma Award. Will you accept it?
Wow.
Then, yes, I will accept. Will you come to Delhi? Yes, I will come to Delhi. And keep this a secret. Don't reveal to your own wife. Because till we announce officially, so you should not reveal to anybody. You are shortlisted.
Right.
Then 1 o'clock it was announced. And next day paper carried the news. The Government of India, 2015 onwards, search committee, 3 months they search. They write to all DCs. They invite nominations from not Tom and Dick and Harry. The nominating person should know his background, give his a good person, and they will recommend a right person. They collect all the names, write to DC, write to particular departments. They have asked about me from Health Department, Karnataka, NIMHANS, then some other people. What Judge Chandrashekar done is good for Padma Award. So they check and selecting 120 people out of 140 crore population.
Wow. Many people watching this may be struggling silently. So what message would you like to give people who are having mental health problems?
So one thing is, see, all of us, I know whether I'm happy or not.
Right.
But as a friend, you may not know that Chandrashekar is happy or unless I express it openly, either facial expression, body language. Because many times we keep things as a secret to ourselves. Put up a smile on the face, but inner I'm boiling. I'm unhappy. So share your happiness, unhappiness with someone you like.
Right.
Don't hide.
Okay.
Especially women, they tend to hide. They can't tell to the husband, they can't tell to their parents where they are away, they can't talk to the children, they don't understand. Isn't it?
Correct.
So because of social, why do you worry, why you are unhappy, money, own building, own house, very good husband, but they don't know he's not a good husband.
Right.
So share your feelings with someone you like.
Okay.
It's a fun thing. And then talk to people.
Right.
Talk to people of your choice, vent out. Don't hide anything inside your mind.
Right.
Whether good things or bad things. Second thing is contentment. Now people are not contented. If you earn 1 crore a month, you want 2 crores.
Right.
Already you have bought 2 flats in Bangalore, you want to buy 3rd one.
Right.
Or you live in a
Correct.
3-bedded house, you want 6-bedded house.
Right.
So this type of over expectation, then wanting more and more, no satisfaction. So we say, tell people, please be satisfied with what you have. Of course, aspire for more.
Right.
You can become ambitious, but don't become over ambitious.
Right.
Desires, cut down the desires, because there's no end for desires. And you have to see how you can express your inner turmoil, either through writing or use music, use other artistic methods, painting and going out, visiting places, visiting people. No, there is a social connectedness. If you are connected to more and more people, you are more healthy.
Right.
And family should be strong. So contentment and good relationship with people. We can prevent not only mental disorders, we can prevent all lifestyle disorders.
What are the signs that one should look out for regarding mental health?
One is your basic needs. Are you able to eat well? Appetite. Are you able to sleep well? 6 to 7 hours of sleep, if you get, you are happy, you are healthy. Third thing is, can you do your routine activities in a disciplined manner and enjoy it? Routine, what time you get up, what time you go to bed, and whether you can carry on your duties and responsibilities the way you want. Of course, some frustration will be there, some drawbacks will be there, but you should be able to do your routine work without getting tired or without getting into a stage of negative feelings. So if you do that, then you know you are healthy or not healthy. And immediately go and keep a small doctor, an MBBS doctor, or if you believe in Ayurveda, any system, go to the person having any health problem. Don't delay. Because people wait till the symptoms become severe. Right. You go to a shop and buy, give me a painkiller, give me some tablet for cough, some antibiotic. So self-medication, go and stand near any medical shop. 70% of people self-medication. They come without prescription. Or they ask the pharmacist, give me a tablet for cough, give me a tablet for vomiting, give me a tablet for diarrhea. And he chooses and gives.
Okay.
Because consulting a doctor, you have to wait and pay him 200 rupees, 300 rupees. Why to bother? Only when things become severe, they approach the doctor, even though there are plenty of doctors now. Give priority for health. Sakala bhagyagalali migilada bhagya, arogya bhagya. But of all wealth, health is real wealth. And health is, you have to acquire. No tonic, no doctor can give you health. Doctors will give medicine only when you become sick. So, if you remain healthy, say at the age of 77, I'm healthy. No diabetes, no BP, no physical problems. Mentally, I'm very happy, contented with what I've done or what I'm going to do.
So, do you follow any simple habits every day for mental health?
No. Morning 5 o'clock I get up and 10 o'clock, 10:30 I sleep. One is fix your sleeping time and choosy regarding what you eat.
Right.
Yesterday, they gave one samosa, one sweet and a couple of chips and the cake, a big cake was cut and the cake was distributed.
Okay.
Most of them are not healthy. Okay, to satisfy I took one sweet and the rest I said, sorry, I don't want to eat.
Right.
So discipline in eating, hita, mita, ahara. These two are very important. Food and sleep.
Okay.
Food and sleep. And then your daily wants, minimize it.
Right.
Daily wants, you minimize it.
Oh, okay. And what would you advise the young doctors who want to take up psychiatry and make a difference?
So psychiatry is number one, discipline. Because everybody can get psychiatric problem.
Correct.
Whereas other only some people. So take up psychiatry, it's a very rewarding, and every person you treat, you grow, your outlook changes, your defense mechanisms become better, and you can deliver goods.
Right.
Because now your severe mental disorders, 70 to 75% you can give good result. Minor mental disorders, if the patient cooperates, 100%. You can come out of depression, you can come out of anxiety, you can prevent suicide, you can prevent unwanted behaviors. A child who is not doing well, you can, after 3-4 years of struggle, you can make the child to do well and become a responsible individual. So psychiatry is very rewarding. At the same time, you should enjoy the profession. Psychiatry is an interesting subject, but it's a challenging subject. Take up. And psychiatrists, you get job anywhere in the world.
Thank you so much. Thank you. Your journey is truly inspiring. Thank you. This has been the Trouvaille Spark, stories that light you up. See you next time with another story that uplifts, inspires and sparks change.
Do like, subscribe and share the Trouvaille lifestyle. Continue to be amazing.